ASH 2015 coverage continues from Orlando, Florida. I'm Thomas Baldrick, joined now by Dr. Betty Hamilton from the Cleveland Clinic. Thanks for stopping by from your conference and spending a few minutes with us.
No problem. Thanks for having me.
So let's talk about this study of yours that you have data for here at this conference.
So yes, what we're presenting on Monday is a study looking at myeloid mutations or common mutations that are found in myeloid malignancies and how they're associated with post-transplant outcomes.
What did you do and what did you find?
So working with one of my colleagues, Dr. Masajewski, in his lab, we have a large database of patients in which we have subjected patient samples to targeted next-generation deep sequencing, and we're able to take a look at their mutational analysis and mutation panel. We then followed them through transplant and did analysis to evaluate the mutation and how it relates to relapse, overall survival, and relapse-free survival, with the hopes of identifying mutations which are significantly associated with survival. And what we found was that not only complex cytogenetics, which is known to be associated with poor survival, is associated with poor outcomes after transplant, but in particular it seems that mutations in TET2 seem to predict for poor survival after transplant.
So it seems like there are possibilities with this study.
Yeah, so there's a lot of data at this meeting even, and over the last few years, trying to understand the biology of myeloid neoplasms, myelodysplastic syndromes, and acute myeloid leukemia, and the way the molecular, architecture of what drives the cellular events of these myeloid neoplasms. And so, I think that we'll be increasingly using this mutational panel or trying to find mutations and correlating it with either a treatment response or outcomes.
How would you go about from here?
So we are planning on continuing our study. So this current study was consisting of 123 patients. We have probably about 200 additional patients that we plan on analyzing as well. So we need to confirm and validate our current findings in this study. We also plan to try to look again at the sort of clonal architecture between before transplant and then after transplant. And if we can identify certain mutations that may be markers of minimal residual disease and can predict relapse before it happens.
You talked about the amount of data here at ASH 2015. What is your impression of it in terms of quality?
So it's really been fantastic. So thus far, today's the first real day of all the sessions, and there's been a lot of, there's an overwhelming amount of data out there, and how people are looking at not only individual mutations or lesions, but the combination of them, the interactions with cytogenetics, the clonal hierarchy or burden of the different mutations, and the different type of mutation. So we're learning more and more.
Well, congratulations on the start to your work, and best of luck going forward with it.
Thank you.
Thanks for joining us.
Thank you.